I'd like to introduce Shannon from the United States, who takes LDN for Hashimoto's. Thank you for joining me, Shannon.
No, thank you for having me. It's a pleasure.
Could you tell me when you first started to notice your Hashimoto's symptoms?
Well, over the course of the past 8 years, I've sort of bounced around from doctor to doctor, not really getting diagnosed properly. And I was originally diagnosed with just basic hypothyroidism 8 years ago. I never had any antibodies tested until 2 years ago with my latest physician. And the symptoms I had with Hashimoto's, I suppose last year, in the last semester of nursing school, I started noticing symptoms that were appearing similar to those of MS. And I knew something was awry, of course. Mm-hmm. And within a couple of months, I saw my physician for a follow-up, and I communicated to him that something was drastically changing. And he tested, a full panel for Hashimoto's and autoimmune issues across the board, and I came back positive for Hashimoto's. So he was not familiar with LDN at the time. I brought that information to him, and of course, as an open and forward-thinking physician, he allowed me to try it. And I went on LDN July of last year, 2012.
Mm-hmm. And what were your symptoms like at that time before you started LDN on a daily basis?
Lots of joint pain, lots of joint pain. I couldn't go for a walk, a normal walk, just a few feet away without muscle pain as well. I had a lot of visual changes, the pins and needles sensation in my eyes, and my eyes were always bloodshot looking. Just drastic fatigue, weight gain, difficulty with my voice. I'm trying to remember everything. Everything from my head to my toes, as far as my skin, had changed. It was very scaly, rough, and dry. No matter, despite how much water I drank or how much moisturizer I used, my skin was just impossible. I started becoming recluse because I felt so bad engaging in social functions. I felt physically ill. Mm-hmm. And just afraid of what wasn't being diagnosed, if that makes sense.
Yes.
And
were you able to sleep?
I never had any sleep issues because I've taken melatonin for years, so I never really noticed that I had any sleep issues at all. Mm-hmm. I know a lot of people do, but I didn't. Foggy thinking, the foggy brain. Mm-hmm. Inability to think clearly, just overwhelming fatigue, joint pain, muscle pain, poor digestion, constipation, which was not normal for me.
Mm-hmm. So when
hair loss, I had hair loss.
Right. Mm-hmm.
Shedding lots of hair at the time. Depression. Of course, depression is a natural consequence of low T3 because the cells starve for T3, so you become physically and emotionally depressed, and I was both. Mm-hmm. For sure.
So when you first started LDN, how high a dose did you start on?
I started on the 1.5 milligram. Mm-hmm. And I held the dose, each dose I was on, I held it for 4 weeks, before we increased. Mm-hmm. The first couple of weeks I was on LDN, I did have sleep problems, and, I'd never had that in the past. but that quickly dissipated after a couple of weeks. It was just that I would fall asleep and then I would wake up and couldn't go back to sleep, and that's not something I'd ever experienced before. But like I said, it was a very temporary side effect. I did have a couple of, it seemed like allergy type symptoms the first couple of weeks I was on LDN, but again, that dissipated as well. I haven't had anything like that since, so I suppose it was my immune system adjusting to the medication.
Mm-hmm.
I'm now on the 4.5, and my April dose will mark 6 months of being on the 4.5
Right.
dose, and I feel like, well, let me back up. I just had my physical labs done for an upcoming physical exam I have next week, and I don't know what my lab work shows yet, but I have a feeling that the LDN has been successful just in my physical symptoms and the way that I feel. And my understanding is that a lot of people, titrate down to the 3 milligram dose after being at 4.5 for 6 months as a maintenance dose. And I feel like that's, if my labs support that, that's probably what I will do, because I did feel better at the 3.0 milligram dose than I'd have the 4.5.
Mm-hmm.
Mm-hmm.
So what symptoms do you have remaining now?
I really don't. I feel like a normal person. I'm working out. I exercise. I do some form of exercise every day of the week without any negative issue. I have no pain to speak of. The only issues I do have, I think that with going on LDN, it's highlighted the fact that I did have gastrointestinal issues that I never really was aware I had that was associated with all of this. And so I am gluten-free and dairy-free. But if I do encounter foods that may have gluten in it, unbeknownst to me, or corn or any grain, I have issues, that I never used to have. A lot of GI distress.
Mm-hmm.
So I have asked my physician to get me tested for celiac disease during my next physical, because I have a feeling that was perhaps an underlying issue that I never knew I really had.
Mm-hmm. And LDN is used for celiacs as well.
That's what I understand.
Yes.
And my compounding pharmacist here in Nashville, Tennessee, is doing something different with my prescription than I think some do. But I was very sensitive to the filler, and I can't recall the name of it now. That's the typical protocol. But he does use acidophilus as the filler for me.
Okay.
And I've done remarkable with it.
Well, it certainly sounds like it, because you had so many terrible symptoms to cope with. It's amazing,
I can promise you that during my last semester of nursing school, I didn't imagine myself going forward into my master's at the time. I mean, I didn't think I was going to live to the next quarter, much less beyond. It was just really frightening symptoms.
Yes.
Especially the symptoms I would have when I say MS symptoms. I had a lot of neurological pain in my face and in my ear, stabbing pains, in the ear. And these are all interrelated. And I know that autoimmune diseases, when you have one, you're predisposed to multiple. So, I think I was on the border of something else, but I was able to get on LDN soon enough.
That's amazing. What would you say to other people with Hashimoto's who are considering trying LDN?
Oh, to please be open-minded to it, and those first couple of weeks that you have anything that's out of the ordinary for you that's disturbing, just please stay the course with it, and get your month in. Work with a knowledgeable physician. If he or she isn't knowledgeable, present them with the information. It's out there. And if you're with a physician who's not open to it, find another, because there are plenty who are. And also working with a knowledgeable compounding pharmacist. Join our support groups on Facebook. That has been fabulous for me, not only as a patient needing support, but also in the way that we help each other. I'm a holistic nurse, so I've been able to bring some value to the table there, I think.
Mm-hmm.
So,
it certainly helps not feeling alone, doesn't it?
Oh, absolutely. Absolutely. And I'm really amazed. I don't understand why so many physicians are not aware of this. There's just a small handful who know, and who are using it. I think just in Nashville, Tennessee, we maybe have 9 physicians in the whole surrounding area who prescribe LDN, which is unfortunate because I'm out educating anybody and everybody who will listen to me about LDN. So I don't know how to accomplish that.
You'll have to tell everybody to go to the conference in Chicago in October.
Okay.
And thank you very much for sharing your experience with us.
Oh, thank you for having me.